thank you so much to all of our esteemed panelists this morning. I am really, really excited. This is a really long overdue conversation. I was talking with my colleague, Maria Siguenza, who is the executive director of the Commission on Hispanic Affairs, and shared with her a number of times during the pandemic about how in our broader presentations, we often touch, but only briefly, on how the pandemic was impacting communities of color, women of color, but especially hard Latino women. And so I was grateful to learn about the really in-depth work that each of you is doing, both with and in studying community. And so thanks for accepting our invitation to talk a little bit both about that research that you've done, which is really, really stunning, actually, I think, the first time that you read it, to recognize how significant the disparities, but also really grateful for the opportunity to hear from Mary Jo, who works directly with women, youth, and families, and hopefully can share some first-person insights. So I'd like to just kind of frame what I was hoping our hour would look like. So I'd like to introduce each of our panelists and collectively, and then ask each of them to share a little bit more with you about their own journey, how they came to this work, their particular passion for working on and with their community, and then we'll dive into some deeper questions that emanate from the economic impact of COVID-19 pandemic on Latinos in Washington State and its toll on women, which is the report I was referencing that comes out of the Latino Center for Health. So if I may, I will start with Antoinette Angulo, Director of the Latino Center for Health at the University of Washington. Antoinette is a public health practitioner and activist in Seattle, earned her MPH from the University of Washington and studied health policy at UC Berkeley. Has worked for over 20 years with Latinx populations, both in the US and Latin America, in clinical research and community health settings, is a really, really experienced policy maker and partnering with key stakeholders to co-produce credible data to inform policymakers, collaborating in multi-sectoral coalition building efforts and advocacy to advance policy at the community, state, and national levels. And really good examples of that include the local healthy eating and active living initiatives, the statewide smoking ban, which we know had an incredible impact across communities of color, and Obamacare, which we use in this context with a lot of love and admiration. So again, as I said, Antoinette is the inaugural policy director for the Latino Center for Health and leads the center's efforts to bridge evidence and policy making to promote the health and well-being of the Latinx community in Washington State. So thank you, Antoinette. I'd next like to introduce Dr. Miriana Duran, from also a research analyst at the Latino Center for Health. Research coordinator in the Department of Health and Population at the University of Washington, but a data analyst with the Latino Center on Health, and really helping focus on and author these important reports. So Dr. Duran completed her medical degree in Mexico and earned her master's in public health and certificate in maternal and child health at the University of Washington, and her interests focus on understanding and addressing health disparities in Latino communities. Miriana is supporting the Latino Center for Health to analyze the data from the COVID survey done in collaboration with the CMAR community health centers to understand Washington State's Latino experiences during the pandemic, and to help develop policy recommendations coming out of those. And then finally, would like to welcome and thank Mary Jo Ybarra-Vega for joining us today. Mary Jo is a licensed clinician and serves in an outreach and behavioral health coordinator at the Quincy Community Health Center in Wenatchee. I love that in your bio, you are described as the proud daughter and wife of immigrants, as a former agricultural worker yourself, and that you're a passionate advocate for social justice for the poor, farm worker, and underserved populations. I understand that your program, I hope that I get the pronunciation correct, Promotor de Salud program, is nationally recognized. I'm looking forward to hearing more about that work. Understand that you completed your degrees in psychology, undergraduate degree at Gonzaga University. I'm a longtime friend and supporter of Gonzaga University in clinical psychology, and then completed your master's degree in psychology at Central Washington, and really have been focused on how to support folks in the Latinx community around mental health. Before I ask you, Antoinette, to take over and talk a little bit about your journey into the work and the insights that you have to share, one of the things that I noticed in the first report that I really had a great appreciation for was how the center talks about, although Latino is the official name of LCH, and then you talk about the multiple identities. May I ask you to reshare that? I think that's a beautiful framing for the larger discussion.
Sure. Well, again, thank you for the invitation to share our work and share our positionality as, Latinas here in this space and with Washingtonians across the state. Yeah, so I think you're referring to sort of an asterisk. So when this organization, the Latino Center for Health, was born about 8 years ago, it began with that name, right, Latino. And names, labels, categories, they evolve, right? And so since even 8 years ago, that has evolved, and terms like Latinx, Latine have emerged, and so we're just recognizing that while the name of the organization is Latino, we recognize the intersectionality. We're not a homogenous group, right? And so that crosses gender, race, ethnicity. We have Afro-Latinos, Afro-Latinx, Afro-Latine, Indigenous, Latinas, Chicanos, Chicanas, etc. Foreign-born, U.S.-born. I mean, I can go on. And that just recognizes the great diversity within this group that we strive to promote health for and within, as Latinas, Latinos, Latinas working here in the center.
I just thought that was such a beautiful and important framing, and so thank you for opening us up with it. And again, if I could ask you to just be the first of the three of you to talk to me about how you entered this work, your kind of personal and professional journey, and why the focus on this work is so important to you.
Sure. So, I'm a fourth generation Mexican American in LA, and Chicana, Latina, born and raised in East LA in my early years. And we moved around a lot, my family around LA, and that exposed me to different neighborhoods, different schools and life experiences. And that's where, I witnessed and experienced inequities across those different spaces. So it was just part of my learning, right? And my parents and my elders instilled the values of service to others. And I've always liked science and math, and had an affinity to health and public health, and wanted to make a difference in those fields. I was lucky to benefit from a good public education, which opened doors for me. I was the first in my family to go to college and was able to, attend a world-class public university. And it was at UC Berkeley where I, for the first time in my life, even heard of the field of public health, which it just makes me sad, because I had to get to college in order to even find out about that field. But I'm thankful that I have, and I had. And UC Berkeley not only introduced me to public health, but also deepened my understanding of social justice and my commitment to that, and the people who I went to school with. And it was just an amazing, life-changing experience. So what I love about public health is just how broad it is and how it's allowed me over the past, I don't want to date myself, but like 30 years to just to work alongside with community members and, as a public health practitioner and activist, and listen to what they feel, their needs are and their solutions for how to go about doing that. And, helping to connect them with decision makers, with resources in order to change, the environments that they live in to improve their health. And working in clinical settings, providing preventive health services to patients and to families that they need, and in language, increasing language access and culturally responsive services, especially to Latinos, Latinx, Latinas. To doing research, I was, got my master's in public health here at the UW, which is a very strong research institution, and got solid skills in that way. And then policy, so in order to sort of be that, what do you call it? The interpreter. So, helping to translate our research and bridge that with policy making, so that I get a lot of satisfaction knowing that our communities feel some tangible impacts from our research. And we can see that through policy and policy making.
Awesome. Thank you so much. Dr. Duran?
Hi. Well, I think my path towards public health is a little bit different. I began my career as a medical doctor in Mexico, where I grew up, and I got to experience very contrasting situations when I was practicing there. So I got to work in private hospitals. We have a different complicated health and patched up healthcare system. So I worked in private hospitals where they had the latest technology, the best doctors, everything, every medication that patients needed. And I also worked at public clinics providing just family medicine care in really underserved populations. And so there I noticed how not only all of the barriers to access healthcare that they had and all of the barriers that we had within the public clinic, but also social determinants that really hindered their health outcomes. And at that time, even though I was a medical practitioner, I didn't even know this concept or the language of social determinants of health. And life brought me to the US. And I think when I was practicing in Mexico, there were a lot of frustrations that arise. I was really happy giving a one-on-one consultation to my patients, and that was very rewarding for me. But I just couldn't do anything about all of the other barriers and issues that were affecting my patients. So when I moved here, I started just exploring other options, and I found public health. And as Antoinette mentioned, it is such a varied place where you can work in different things. So I started learning all of these concepts. I started learning about social determinants of health and just became really passionate about that. And one of my areas of expertise is qualitative research, which is trying to understand through interviews and focus groups, what are the issues and where our population is coming from. And I think now that I'm working as a research coordinator at the University of Washington, I get to use the skills I learned in my master's, either using that to adapt existing programs that are wonderful, but that weren't tested with Latinos, just to make them culturally relevant so that they will work for our population. And one of the things that I love about the work at the Latino Center for Health as a data analyst is that data can support policy change. And that is one of like the big things from public health that I did not have as a medical doctor. I could only change one person's life at the time. But here, I feel like the impact is at a greater scale. And that is just really motivating for me. And I think, yes, like all of my motivation arises from being a Mexican immigrant here and just knowing the issues that we have in Mexico and here, and just getting to know our population and understanding what they need to have a better and healthier life.
Wonderful. Thank you so much for sharing. Mary Jo. Oh, we have you. I think we still have you on mute.
There it is. Good morning. Buenos dias, everyone. So I want to just do a little thing that we do. Promotores de salud, the community health workers like to do dinámicas or kind of icebreakers to introduce ourselves and kind of get things going. So I'm going to do that if it's okay. I'm going to show you where I live and maybe you guys can help me. So if you guys want to raise up your left hand, everyone, if you guys could, thank you so much. And then if you roll down your fingers like this and bring in your thumb, that's the state of Washington. And Quincy, Washington is right in the middle. We're the belly button. We're that sacred place. So that's where I work at and was born. So thank you so much for joining in that little dinámica with me. I am super proud to be with you guys and honored to be with all of you today. As I mentioned, I am from Quincy, Washington. I was speaking with my mom the other day about how things have changed. And she said, you know, we were the first family to be allowed to buy a house in Quincy. Oh. So that's in just our generation. And we talked about my brothers and sisters. I had 4 brothers and 1 sister, and 2 of us were not allowed to be born in a hospital in Sunnyside. We were allowed. My mom she had to go to the reservation in Toppenish for my older sister Isabel and my brother Emmanuel to be born there. And we just talk about how things have changed. And then, you know, in that same generation, having the privilege and you know, the blessing to be able to go, all of us to go to college and to attend a university. So I'm really, really proud about that. And as I mentioned in my bio, I am also a farm worker myself. All of our family was. I continue to sleep with a farm worker. So that's also gets me really close to that population. And I also have the honor of serving that population here at Quincy Community Health Center. Quincy Community Health Center is a satellite of Moses Lake Community Health Center, and we primarily provide services to all of Grant County, which is basically all of North Central Washington. The site here in Quincy primarily serves migrant seasonal farm workers, and that is part of our mission statement. So I'm really proud to work here, and I tell people I just can't believe every single day that I get to come and do that work. I'm really blessed to do that, and I just love what I do. And again, that honor that I feel to work with the population that I do, it never goes away. Even in the pandemic, I felt even more privileged at that time. I think you mentioned I went to Gonzaga University. That was very difficult being away from home. I think I remember being homesick for about 3 months. And there wasn't very many Latinos at the time, and we seemed to find each other when we were in Spokane. Even if we saw each other in the malls, we're like, hey, and we would say something to each other. So I'm really blessed to have found my friends and my lifelong friends from Spokane. And then I have to say that one day that I was I think I took the day off with my friend, and we decided to stop by Central Washington University, and by chance or by God's grace, we met this very attractive young gentleman, and my friend said, come on, be my wingman. And she said, go talk to him. And I said, okay, so where's the library at? And so we started talking. And he asked me, hey, are you thinking about coming back to school? And I said, well, and she's like, come on, say something. And so I said, okay, well, yeah, sure. And he said, you know, we have this great program, master's program in counseling, and you should think about it. And my friend goes, come on. And I said, okay, well, let's go to his office. You know, she's still trying to score a date. And so we went down to his office, and he asked me, you know what, just type a few letters that you want to come to the university. There's a great fellowship program for minority individuals who want to enter the program. So write a little note about that. And I did.
That was the Patricia Harris Fellowship, is that correct?
Harris Fellowship. There was only 13 of us in the nation. And so, you know, I get grace of God, or my best friend, who helped me have that happen. And 2 weeks later, here I got my notices. And I was off to school. I was the first one in my family to receive a master's degree. And so that was kind of how things happened. And full circle, worked in the West Side and Consejo Counseling and Referral Services and several school districts, at Big Bend Community College and other locations, and then made my way back home here to Quincy. And I do live in Wenatchee, so it's a commute, but I love it. And I've been here at the clinic close to 20 years. Thank you so much. Yeah.
Absolutely. I have to say, one of the things, so I've worked in the nonprofit sector for well over 20 years, and I'm only relatively new to government. I've been in my role as executive director for about 18 months, but prior to that, I was one of the original 9 appointed commissioners when the Women's Commission was established in 2018. And I will tell you that the very favorite part of my job is having the opportunity to meet extraordinary women, leaders like you, who are doing the work that you do so passionately with so much tie and commitment to the communities that you serve. I think any of us who have vested our careers in mission-related work, you know, do so because of our love for the people that we serve, and that clearly comes across from each of you as you share your story. So thank you very, very much for that. And Mary Jo, just know that I'm going to circle back with you specifically after our session, because our next Women's Commission quarterly plenary meeting we're hosting in Wenatchee. It'll be a 2-day meeting, and my intention was for us to have the opportunity to not only speak with the corporate agricultural growers who we'll be spending part of our time with, but to spend time with community, hearing about the experiences of your friends and neighbors. So I would love it if you and I could partner in that convening. So, well, again, thank you. Just so grateful to have time with you this morning, and just wanted to touch bases about these really impactful reports that the center put out. So the first that I briefly referenced earlier, I understand that you all put out in December. Again, the name of it, The Economic Impact of the COVID-19 Pandemic on Latinos in Washington State and Its Toll on Women. And some of the facts that I read that really, I just was hoping Dr. Duran or Antoinette, you maybe could elaborate on, was really how significantly, we know that, you know, the pandemic has been horrible for everyone, but we also know that in the earliest months of the pandemic, it was Latino workers who were the workers that lost the most jobs based on their overrepresentation in the sectors that had a lot of job elimination. And one of the statistics that really stood out to me talked about Latinas leading the workforce at twice the rate of men, but 8 months later, 4 times that rate, which is 3 times higher than white women, 4 times higher than Black women. And of course, we know that those households led by single moms, that impact is even more proportionate. And as I understand it, about 19% of those that you surveyed were Latina mothers leading households. There were also some important conversations about the financial impacts, and I was hoping, and then there was a specific survey, I believe, Dr. Duran, I believe you helped lead the implementation of that survey, the Understanding Washington Latinos Experiences. I was hoping that either or both of you could talk a little bit more, give us a little deeper dive into those statistics and the experiences that you learned about and reported on through the survey and in the policy brief.
Yeah, I can start answering that. So the Latino Center for Health developed this survey, which aimed to understand the experiences of Latinos in the state around COVID. And so we developed the survey, and then it was administered at CMAR Community Health Centers. And that happened between October of 2020 and then February of 2021. And from that survey, we started analyzing different data and have created a series of briefs that have talked about different issues that were experienced by our community. So I believe the first one was vaccine hesitancy, healthcare access, like different briefs. And then this last one that you're referring to was originally trying to look at the economic impact of the pandemic on our whole sample. But then we decided to look at it by gender to see if there were any differences. So we looked at economic variables like unemployment, household income reduced, that kind of thing. We also looked at insurance, food and housing, and a very important variable that is taking on new child care or caretaking responsibilities. And so what we found, I have some of my notes to help me remember the numbers. So overall, as you were mentioning, 73% of our sample were essential workers. These people were working from food service industry to construction, farm workers, and housekeeping and maintenance. And overall, it was really shocking to find that 60% of all of our sample, both men and women, reported that their income had been reduced because of the pandemic. And then looking at differences between men and women, we found a greater percentage of women who reported to be unemployed at that time. We know that throughout the pandemic, the statistics we got from the literature that were reported in the brief talked about the beginning, how they lost their job as twice the rate as men, and then a couple of months later, it got worse. So just to remind you that this was at that point when they responded to the survey. And here we found that 45% of women reported that they were unemployed compared to 34% of men. And then we also saw that women tended to have part-time jobs more than men, which was probably really related to some of the benefits that they were not getting because of having a part-time job compared to a full-time job. And that makes sense when we looked at their insurance. We found that women were more uninsured than men. And this was 45% to 40%, but they also had less public insurance than men. And this was 38 to 30%. And then looking at other variables, as I mentioned, one thing that was not unexpected, I guess we all kind of saw that happening and heard about it, was that women were taking on these new childcare responsibilities, like helping their children with school at home. They were also taking on new caretaking responsibilities, like caring for family members. And probably this also has to do with why they were more unemployed or working more part-time. So we found that 36% of women were taking on new childcare responsibilities compared to 25% of men. And then, I mean, we wanted to keep it short because it's a policy brief, so it's meant to be short. We wanted to look at all of these other issues, but just to, for the sake of time, other outstanding challenges that we found or issues were that overall for both Latinos and Latinas, 53% of our sample were worried about running out of food several times a week. And yeah.
When I read that, I took note that it said 40, as you said, 47% worried about rent multiple times a week, and 53% worried about food. And just having had a season of struggling single motherhood myself, I remember that feeling, and just to recognize that there were so many people, were and are so many people just struggling with concern about meeting basic daily essentials is shocking in a nation as wealthy as ours. And certainly Washington State is a place where I'd like to believe we are invested in making sure that everyone has appropriate quality of life. So I really, really appreciate that you honed in at that level of depth to help inform the policy arguments that we need to make on behalf of folks, because as we know, nobody should have to even think once, let alone be weighed constantly with the worries about housing and food security. So thank you for letting me interrupt.
Yeah, and you just finished the last statistic I was going to say, like being worried about paying rent. And I think it was really shocking to see how our already vulnerable population of Latinos in the state was not being able to meet their basic needs, as you mentioned, not having health insurance during like a public health crisis, like the worst we have seen. And in addition to that, being concerned about running out of food, about their housing, and just thinking about these people who are mostly essential workers. So they're keeping things going, they're feeding our country, and at the same time, they're not being able to feel safe at work, have their basic needs met. So yes, it was overall just really shocking.
Thank you. Antoinette, anything you'd like to add here?
Yeah, I'd just like to circle back to our earlier conversation around intersectionalities, and just, remind us all that here are these intersectionalities, right, of gender, of race, ethnicity, let's add country of origin, immigration status, whether folks are Latinas are documented, undocumented, all of that. It really compounds, intensifies, and multiplies the challenges and the impacts and these disparities that Miriana, had just described amongst Latinas during the pandemic, and continues to, in terms of what they're experiencing. So that's what we all need to keep in mind. I'd like to provide that frame, as we're talking about these issues, amplifying them and communicating them to, decision makers, policy makers, people who can allocate resources. It's multiple layers.
Absolutely. One of the things that I don't know why I found it shocking, but I did, early in the pandemic, when the stimulus checks began to be issued, to every American, and then learned that, our folks who are not documented were not able to receive those funds. And I think one of the proudest moments I've had of being, relatively new Washingtonian and, a member of the governor's cabinet was that it felt to me like our state worked much more quickly than others to create that same kind of support for our undocumented, community friends. And but I'd wondered at that time if, because I know amongst a lot of our communities, there's a historic mistrust of government for good reason. And Mary Jo, can you talk a little bit about that time and maybe how folks were able to or unable to kind of access the kind of support they needed during the peak of the pandemic, and how you might have worked to to try to help get supports to the people who needed them, overcoming some of those trust issues?
Yeah, I remember as you guys were talking about it, I wanted to add that not only did undocumented workers or undocumented individuals not receive that fund, people who are married to undocumented individuals didn't receive that fund. So that you can just, imagine, what they felt like. It's like, I'm a US citizen, and because my partner is undocumented, I'm being punished as well. So, I remember that part, but during that time when the pandemic was all up in all of our grill, I think what we ended up finding out, and again, like you said, we were really happy that our organizations like YSIN and our state and other organizations came together, made a fund available to undocumented individuals. And we had this crazy thought that maybe we could help on top of everything else that we were doing. And I remember the executive director at that time, she called me up and she said, "Hey, Mary Jo, what do you guys think? Do you guys think you can help in that area? You guys are so good at what you guys are doing." And I'm like, I don't know, call up our CEO, light a candle, bring down all the saints and see what happens. And I remember she told me she was on the beach in Hawaii when she called our CEO up, Sheila. And, she called me up, she goes, I think she said yes. And I'm like,
Yes.
yes. And I said, no way. And so while we were overwhelmed because we knew that we were going to get slammed with everybody calling us, we didn't care. And we just said, we'll just stop everything and let's just give money away. And so our team came together. We pulled promotoras that we knew and trusted, really wonderful young ladies. And they taught us so much about technology and what's up and what we needed to do to get those people to call us, because we couldn't receive them either. So we had to teach people how to use technology and certain applications to be able to come or to see us and talk to us to apply for services.
Right, because at the time, because of COVID, most social service organizations were not seeing clients.
Exactly.
Right.
Yeah, and I think one of the things I'm really proud about during that time is that my understanding from different state officials and other organizations is that we were the only clinic in the state of Washington that their outreach department never stopped doing outreach in person. We were the only ones doing that. And that was something I was really proud about. I tell people sometimes I forget that we put ourselves on the line, but we did, but we just did it with our heart because we knew our community needed it. So we gave away thousands of dollars through the clinic. Very proud about we did look at the percentages. We were really good about how we did that. We found all the little nuances on the application to make sure that happened. And again, women were calling us. We had a huge group of indigenous populations from the Othello and Warden and Royal City area that you could tell their community would talk to each other, because then we started getting lots of calls from that region. But we were really happy to help with that. We were exhausted, but we did it. We didn't care. We just wanted to get that money out to people because they needed it so much. And I think La Doctora Duran, what she was mentioning was so true. Women in particular lost their jobs. They lost their freedom. They didn't have a choice. They lost but they also had they became teachers. They had to learn about how to use, become digital when a lot of the families, their only way to communicate and do homework was with their phone. So many children were doing their homework on the phone. And in our rural areas, in particular in North Central Washington, because we're so isolated, sometimes there wasn't access to Wi-Fi. I know that our district helped later, but by that time people were impacted. And the Wi-Fi for 4 or 5 kids, and you don't have 4 or 5 computers either. So there was lots of things that we're not even talking about. I know, like, again, La Doctora Duran didn't talk about all those small details you wanted to ask, but you can't. There was another important study that also happened, and it was a California, Washington, and Oregon COVID farm worker study. So the cough study, if you guys haven't looked at it and seen some of the information from that one, very telling. I was also proud to be part of that work, but also talks a lot about the work that we're discussing now and the things that we talk about. So again, I'll stop there because I want to hear so much more from Antoinette and La Doctora, so I'll stop there.
Well, I just really appreciate you illuminating, you know, what you saw and experienced, and want to thank you again. You know, it's not too dramatic to say that you and your team were literally putting your lives on the line when you were working to make sure that folks who did not have income received the support that they needed, and just cannot thank you enough for that. I have so many questions as well, and I'm also cognizant of our time. So it's 12:41. I think I wanted to transition from hearing about those very important kind of and significant disparities of impact during the height of the pandemic, and wanted to transition to kind of what you're seeing today, Mary Jo, relative to the families that you serve, the women and young people, and kind of what are the experiences today relative primarily to mental health and economic recovery, or not?
Yeah. So one of the things that we're seeing here in particular is something that you guys mentioned before, and this was happening as COVID was happening, as a lot of agricultural work is becoming more there's more automation in the fields, as well as in for example, packing sheds. You saw, you know, hundreds. In a town like Quincy, where you see hundreds of people losing jobs like that, and they're primarily women that do that job. So they lost their jobs because through automated circumstances, or COVID, or because while they were being protected, other people weren't being vaccinated, so they lost their jobs because of that, and companies had to close down for a long time. So you saw lots of that happening, but I think some of the things we began to talk about at the beginning was that moms would tell us, you know, we're not working, so there's less income. There's half of the income coming home. We had to cook two times for breakfast, and we have to cook for lunch, and that means we have to buy more food. That means we have to use more electricity. That means I have to wash dishes 2 extra times. But that's a big cost that people didn't think about. And a lot of the children that we saw were receiving free and reduced lunch. So that's money that also came out of an income that had been cut in half. And then, you know, I think the other thing that started happening is that work for a lot of agricultural women is a time to socialize, a time to gain, you know, friends and community support. And so that breaks down as well. So what we started seeing is a lot of women, again, being isolated, going into depression. We saw, you know, lots of people, you know, we were just talking about it this morning. We had a diabetic eye exam here in Moses Lake. And one of the things that the provider saw was that a lot of people's, their retinal eye screening was not good at all. And he said, we think it's because the pandemic just did not allow them to take care of themselves, or they have to take care of other people, or because they couldn't come in because they couldn't pay for the cost to come into the clinic or take care of their needs for their diabetes. So those kinds of things impact all of that. It's just a domino effect for women's mental health, you know. And while I say that, I also have to say that, you know, I think women of color, you know, Latinas, we are champions because we are, I think because we've already lived difficult times, and we come from impoverished situations, it didn't, I shouldn't say this, but it's like we have like a tough skin, right? So we said, you know, we've done it before and we can do it again. And I think we just, you know, we took the punches and we took them well. And I think that people started calling each other, people started using the phone a little bit more. And I started seeing people walking with their kids more. So there was things that I think our community did to try to salvage that, their wellness, especially that mental health piece. But I'm going to say the one piece that I'm very concerned about in particular is how our children are doing, and they're not doing well. So, you know, here just locally, I know that we've had a couple of people bring guns to school, talk about shootings, people bringing knives to school. We're having children assaulted at school in the middle of class, in front of teachers. There's just so much of that happening, and schools do not have the support, the mental health support that they deserve, and in particular the children. So that's one always been a huge issue for me, because I also did school counseling here in Quincy in particular, but that's really close to my heart, and I just don't think our schools have what they need. You know, they're already dealing with other things, but the mental health support that our children need is really huge. But it just screams that the kids are that way because their parents are suffering that way, right? So the kids they're just a little microcosm of really, you know, who's really suffering as well. So if we say our kids, that they're just a little picture of what the big picture is. Yeah,
absolutely. So we talk about, and thank you for highlighting, we talk about the resiliency of women of color. Not too long ago, we did a discussion about Black women and mental health, and this notion of this trope, I'm going to call it, of the strong Black woman. And yes, you know, Black women, Latino women, you know, women across the board have had to be stronger because of these horrific structural systemic racism, you know, that has just made our lives harder, honestly. But it is also the case, I have found, that as a community, we do tend to come together and provide support for one another in a way that helps keep you well when you're not sure you're ever going to be that way again. In hosting a conversation similar to this, a couple of months ago, I have 4 young grandchildren, and I reached out to their mothers and said, if you could use one word to describe for me how you're feeling as a mother who's been mothering through a pandemic with 1, 2, or 4 children, what would you say? And overwhelmed was, you know, the word that 2 of them used. One of them said exhausted, and the other one said, you know, I'm not a rule follower, exhausted but hopeful. And so, and I just walked away, and I have had so much empathy for, of course, the young women in my own life, but, you know, every mother I know, you know, raising dependent children just has proved to be a superhero, you know, over the last 2 years, and have so much gratitude for that. I see that there's a question in the chat that Leah has forwarded to us from Leo Morales that says, how will the state of Washington address the educational impacts on Latino children? What investments are planned? Will access to broadband in rural areas be addressed? And I'm going to say that I don't have at my fingertips the accurate numbers relative to investment, so I don't feel qualified to answer that question. I am going to ask any of the 3 of you if you have any knowledge of any specific educational investments that I maybe am not aware of. I do know that there has been significant investment relative to broadband across the state, particularly in rural areas. And I do know that data around that issue and probably also broader educational investments can be found on the governor's website and specifically in this year's budget summary. So again, really proud that both our governor and our legislature did a really extraordinary job over the last 2 years of looking at how to invest in making sure that everybody was able to recover from the impacts of COVID. And there were a lot of investments made, particularly for our usually least resourced communities. And there was a lot of amazing advocacy from educational and BIPOC groups across the state, really to make sure that the legislature was paying attention, and OSPI, the Office of State Public Instruction, that they were really paying attention to the learning gaps that were created for kiddos who did not have access to broadband early and or in-home supports that really allowed them to keep up with some of their peers. And so, Leo, that's a really important question. I'm sorry, I don't feel able to answer it with specificity. I'm going to toss to Antoinette and or Dr. Duran and Mary Jo, and we'll also encourage you to visit the governor's website and look at the recent budget summary. Antoinette, Dr. Duran, any comments about how any of the research that you've done touched on the issue of education?
Yeah, we generated a policy brief. Dr. Miriana and Duran and Dr. Natalia Jimenez were co-authors on that. And just returning back to school, the center also hosted a virtual symposium in October of 2021. And Mary Jo was generous with her time and spoke to the experiences across the state. And I'm a mother myself, and here in the Seattle area. And I think, when we talk, mental health is huge. And, as a mother, you are the secure base, right? A secure emotional base for your children. And we set the stage, we set the tone in our home so that our kids can feel the safety and the security that they need, right? And especially during the pandemic. And yes, we're resilient and we know how to navigate these tough, lean times, and it's not without its toll. And talking to a lot of Latinas, a lot of moms, trying to, be strong and just create that balanced, safe, secure space at home, while knowing that our kids, are struggling, their mental health is struggling because they're not in person at school, they're not able to see their friends, all these protective factors, even extended family, while everyone's trying to stay safe. That, definitely weighed down on moms, not to mention these other factors, right? Like the inability to meet basic needs, the chronic stress of all these different issues. And if they were essential workers and did have some work to go to, they couldn't work from home, right? So the stress of who am I going to leave my child with, while they're Zooming in or, trying to stay with their school curriculum, or I just leave them alone. And are they going to be safe at home? And if you're undocumented, there's just a whole nother level of safety and security. So there's just so much to dive into and so much to unpack, with that, Regina.
Absolutely. Thank you. Thank you. Miriana?
Not to take the conversation to another topic, but Mary Jo was talking a lot about mental health, and we also have a policy brief around mental health. It's not focused on children because they weren't included in the survey, but I think, as Antoinette mentioned, parents' mental health really has an effect on their children. And in case you're interested, that is also available because it is such an important issue that I also experienced myself as having 2 girls being isolated from school and all of that. So it is a very important issue as well.
Absolutely. And I noticed that we're in the last 5 minutes of our conversation, and what I wanted to kind of close with is both, again, the thank you for bringing your expertise to this conversation, but more importantly to the work that you do more broadly. And my intention with this conversation was really just for it to be the beginning of our conversations together. What we do after each event like this is our amazing communications team puts together a blog post that not only reshares the link from this conversation, but it will also outline some of the issues that we've talked about. It will provide links to the reports that you've mentioned. And so, Miriana, I would really love for you to send me any additional policy briefs beyond the two that we've talked about. So the two I already have are the economic impact and then the new child care and teaching responsibilities. But any other reports that you'd like us to embed in that post that then can lead people directly to your sites and to the work that you're doing. Mary Jo, also, if you have specific resources you'd like us to help amplify in that post, and then we will also reshare this so that it touches a broader audience. But I had a final question that I'm not sure we have complete time to answer, but I'll plant it. And then if there's anything briefly you'd like to share here, but more importantly, if there's anything you'd like to have in a follow-up conversation, I would really appreciate that. So the Women's Commission will in early summer go into our strategic planning retreat to scope out what our real focus will look like for the next 2 years, and really what our policy priorities will be going into the next legislative session. And we always choose to work with our partners who are working closest to the populations that we want to advocate on behalf of. And so would really welcome, I was hoping that you or Antoinette would just give us quickly the policy recommendations that came out of the economic impact policy brief, but also I'd love to have you all join us for a part of our plenary session to share your policy recommendations and things that you'd like us to be thinking about as we develop our strategy for the coming 2 years, so that we can really work to amplify and add, hopefully, influence to the issues that you are working so hard on.
Thank you, Regina. I want to underscore why is this important that we're talking about Latinas, right? And the economic impact of the pandemic. We're all interconnected, like it or not, we are all interconnected. And so that Latina farm worker is a critical part of our basic food system. And so when she's not well, our food system we're not getting our food, and we're already experiencing, the supply chain shortages, rising food prices. And so when she has her basic needs met, but we don't want just that, we need her to be successful. Washington will be successful. Our country will be more successful. And so all of those wraparound services, right? Expanding federal unemployment benefits, increasing the minimum wage, especially for our low-income essential workers, relief funding for childcare, providing support to undocumented, Latina immigrants, and enhancing workers' rights and protections, keeping them safe. That's going to make us all, better off. And a recovery, just a just recovery to allow Latinas to heal through the trauma of this pandemic. It behooves us all to support that kind of, policy.
Regina, if I could just say something that I didn't say, and I'll say it very briefly. I wanted to thank all of the community health workers and promotoras de salud, not only in our state, but across the country, the territories, and the islands that, for me, were the champions, unsung heroes and champions. We found ways when our state and our federal government could not do so. And if you guys are going to be talking about what to do, is look closely at what they did, look at their successes, and also what held them up, because I don't want to go backwards. We need to move forward with the work that we've done. And I would love the commission support regarding that workforce in particular. Gracias.
Absolutely. Thank you. We will invite you to come share those lessons and requests at that meeting. So thank you. Miriana?
I think just going along the lines of what Antoinette was saying is that we need that support for our women. We need them to have childcare support so they can go back to work, so they can re-enter the working system. And also, like, one big thing is that we also need to provide for undocumented immigrants, because Latinos are the greatest percentage of undocumented immigrants. And a lot of them, as Antoinette mentioned, are feeding our country. And I think it is essential that we consider them as part of our country as well.
Absolutely. Thank you. I wanted to read a couple of things from the chat. There's a wonderful comment from, looks like Millennial, perhaps. She says, thanks for the insights, updates, relevant information from all the panelists. I don't want to get ahead of myself, but this should be a movement, and we should continue to meet and discuss issues affecting the Latino population in Washington state communities. You are not getting ahead of yourself. That's exactly why we're here. And I would encourage anybody who participates either in the live session right now or is reviewing online to follow up on the Women's Commission webpage, where you'll be able to find all the documents we've talked about, all the issues that we've talked about, and most importantly, the links to the organizations of these incredible leaders, where you can learn more about how to connect with their work and support it. And I'd like to say that it's my intention that the Women's Commission will be a voice for all of the women in Washington state, and that when the legislative session comes, back into play, and there are issues that impact our communities, that we will have developed the community organizer in me intends that we will have developed a strong base of constituents that we can call on when our legislators need to hear from the people who are most impacted by these decisions. And so we hope that you'll subscribe to our newsletter and join in to receive those action alerts and really become help enable us to be a force in that movement, if you will. So I want to thank you for just the time that you've each committed today, and I'm delighted to have met you and so excited about our work moving forward together. And I will be individually in touch with each of you very soon.
Thank you.